थोड़ा blurred है, एक second. So actually don't clear. Yes. Now even if I do 4 cuts, let's say I'm doing this here, then more, I'm never going to go more than 0.3. Correct? Because it's a limiting burr. I cannot go more than 0.3. Joint. That means this happens to be the internal line angle. Internal line angle means the line angle that is going to be inside of the veneer. Anything that is inside of the veneer cannot be sharp. So this internal line angle I will have to smoothen. So okay, can you see where the powder is? That line angle is now smooth. Is that clear? Point number 1. Point number 2. Here, reflect kara. And you occlusal mirror there. The incisal table. Okay, so point number 1 we discussed was internal line angle. Can you see the mirror? Point number 2 is incisal table. That means this. Incisal table. This line. Okay, not this. What I'm marking here is the external line angle now. The line that you see is the external line angle. External line angle has to be sharp. You don't need to make it sharp. It becomes sharp by default and you don't smoothen it. Clear? Internal line angle has to be smooth. Now the line in between the internal and the external line angle, that means this line, thickness of incisal plane, caliper, which means this one. Okay, I'm going to now hold it. Is everybody clear?
Yes, sir.
Thickness of the incisal plane. Thickness of the incisal plane. Correct? Has to be 1 millimeter. These are super important points. Super important. Smooth internal line angle, mandatory non-negotiable requirement. Super. Moving on. So far so good, like a routine prep.
Yes, sir.
Now, instead of this as a 90-degree flat butt joint, we are going to prepare a shoulder or a small, not shoulder, I repeat. I take it back, repeat, not a shoulder. Small chamfer here. My burr is not perpendicular to the long axis of the tooth. Parallel, like how I'm doing a margin here. You may not be able to appreciate this perfectly here, but when we see a scan, you will see it perfectly. You may not. I can see it, so I'm hopeful you can see it. Can you see like this?
Yes, sir.
That there is no, so the cusp is not touched. The cusp is still there. So my veneer is going to come and end here. My veneer is going to come and end here. Okay? Can you see where the veneer is going to come and end?
Yes, sir.
See how far that is away from the central developmental groove. That means the lower premolar will not touch my ceramic. Clear?
Yes, sir.
This is called as a window prep. That means, I'm going to zoom in again. I am not doing this. If I were to do a prep like that, my preparation would go until the central developmental groove, until the groove in the center. Okay, you see how buccal my margin is. Clear, guys?
Yes, sir.
Perfect. To get a better emergence profile, is that clear? Only in case of diastemas, to get a better emergence profile, it's a good idea mesioproximally that means here, because the veneer needs to squeeze this gum and give me a good emergence profile. We will be discussing again this in detail when we do preps, don't worry. That's it. Only in case of diastemas, I repeat that. Okay, so now we're going to put cords everywhere and then start scanning, okay? I'm going to now change camera so that we can see the scans and we can see everything. Okay, I'm going to put one more cord and then we'll see another way of retraction. Cord packing is mandatory, it is not optional. Is mandatory. Retraction cords is a non-negotiable requirement. It's a mandatory, or retraction, let me put it as that. You can choose to do it in other ways. Retraction cord, please. You dispense the paste inside the sulcus and wait for 4 minutes. Retraction paste does not get you vertical deflection. Retraction paste gets you horizontal. That means you can't push the gums down. Okay? For me, this is the second choice. I would use this only if it's a supragingival margin, where I really don't need vertical deflection. Clear, guys? Is this? Guys, settle down, please, settle down. When that is tomorrow morning.
Okay, mock-up guide. I strongly encourage you to take the video, go home, share this video with your nurses and train them to do this. My nurses make templates better than I do. Okay, adequate buccal thickness. Little beyond the cingulum. Little, okay, not onto the soft palate. Little beyond the cingulum. Once it comes out, take a nice blade or a putty cutter. Blade is also good. And cut it 1 to 2 millimeters above the margin. 1 to 2 millimeters, not more than that. You will then take a nice 15 number blade, which is also there in your kit. Perfect V-shaped cuts. If you overcut, it's okay. If you undercut, you will have excess pro-temp that will be seen as flash, that will go on to the gums and the patient may not like it. When you remove it, you may make the gums bleed. Exactly like this, V-shaped cuts. Is this clear so far? Okay? Done. Lights on, karo. Okay? Until now, once you remove it, you will take a 15 number blade and cut as close as possible. You need to go exactly at the gum margin. Exactly. Okay, you see, that is extra. That is not allowed. You shouldn't have anything extra. Otherwise, that flash will be seen on the gums. Agree? So now you take a blade. And cut exactly like that, even interdentally near the papilla. If you saw in Sakshi yesterday, there was nothing extra. I removed nothing. It saves your time, and the intention of taking the video is please go home and share this with your nurses and train them. You don't need to be doing all of this. Train them to do everything. Okay, little extra is okay here, no problem. What will happen is it will be a little short. Mock-up doesn't matter. During the final temporization, you can add over there with ProTemp, no big deal. But if it is extra, you will find it difficult to remove from the gums, which may lead to bleeding. Our first intention is mock-up, most important appointment. Always mark the midline, always mark the midline. Okay? Is this clear? Until this time, your material is now. This is very simple, it's not a big deal. You're mixing it as fast as I'm mixing it, like Superman. And then put it onto the palette. Once you put it onto the palette, tap, 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 tap. Okay? Tap it. It has to go beyond the incisal edge. That's it. It has to just go beyond the incisal edge, up to the incisal edge. I repeat, I'm sorry, I repeat. Up to the incisal edge, not beyond the incisal edge. I'm repeating it. Up to the incisal edge, not beyond. If you think sometimes you've marked extra, you can cut it out. Okay, it can be easily cut with a blade or anything. Okay? Yes. How long, Dr. Mercy, does it take to prep 1 gram? How long does it take to prep 1 gram? Multiple times, but it's not happening, or I have micro gaps, small diastemas like Sakshi. Everything was type 1 prep. We will do minimum 1 2 or 3 depends on your speed. Okay, we will give this 10 minutes. Type 1 prep. Everybody has your own setup. Connect your rotors and start when we start. Let's get into the demo. Okay, shall we start? You're free to take a video of this. Exactly like how we started. All the bars are there. The first will be the depth cutter. Once you do the depth cutter, mark the depth cutter with a pencil and then take the TR25. Now, please understand, it's easier to prep teeth. It's difficult to prep actually. Please use the blue ring, the TR25. And then if you want to finish later, you can use the yellow ring. In the mouth, please use the yellow ring straight. But acrylic, if you use the yellow ring, it will flake out. Okay? Let's start with the video. Okay? You can even take a perio probe and mark the 1 millimeter. Even that is an option. I don't do it like that ever. I mark straight with a burr. Okay? Now, if it is a tall tooth, 12 millimeters is a tall tooth. Huge people. Ranbir Kapoor is a tall guy. He has tall teeth. So your burr may not touch the bottom. So you can first, instead of doing the depth cutter on the facial surface, you can reduce first the length of the tooth. Okay, how much of incisal reduction depends on you. If it's press and stain, 1 millimeter is good. If it's layered, 2 millimeters is the minimum requirement. Okay, so let's assume we're doing layered. Okay, you can do all 2-3 teeth together. If you think you want to concentrate on one tooth, you do one tooth. I leave it to you, your choice. Okay, but we won't take a lot of time because we have to do one type 3 prep, we have to do one worn down premolar for a winlay or an onlay, we have to do a window preparation, everything. The prep of the upper central and the lower central is exactly the same. Okay, you can do, like I said, 3 teeth, depends on you and your speed. Do you follow the cusps on the canine? Not mandatory, you can. It's not mandatory. Okay, you can smoothen it like this, or you can use another burr that is there in your kitty, that's the straight fisher burr. SF41. It can also be used. The intention is to make it flat, that's it. There's nothing else. That's the intention. Okay, I have first done the incisal reduction because it is a tall tooth. Otherwise the handpiece, the burr doesn't reach the bottom. The head comes in the way. Okay, now you can do one more time because I'm planning to do layered. If it is press and stain, this much is enough. Layered, give the technician more space to add decent amount of ceramic in layering so that it doesn't chip. Veneer preparation. Veneer is really not dependent so much on preps. It's a lot dependent on treatment planning. Treatment planning is more important than anything. Okay? You can then use your 0.3. Now this can be 2 plane. I never do 3 planes. It's too confusing. 2 plane for tall teeth. If the teeth are shorter than 10 millimeters, single plane. Right? That means if the handpiece is not obstructing from top to bottom, single plane. If the handpiece is obstructing, then 2 plane. Over here the handpiece is obstructing, so 2 plane. Okay, you then mark with a pencil. The areas that are marked indicate where the burr has touched. The areas that are unmarked is the untouched area. The areas that are marked have reached the depth of 0.3. The areas that are unmarked have not been prepped at all. So we need to now prep those down to 0.3. Correct? Please keep your videos on. I am moving on to the other video, video number 2. Okay, I repeat, you can keep them on or you can pause it for a minute, whatever. Okay, you can check with your incisal templates whether you have your desired 1 or 2 millimeters. And then you start prepping. I repeat, on the model, please use the blue ring. It will make it faster for you. If you see the head is coming in the way, it's not going out to the bottom, these would be 2 plain teeth. But if the head doesn't come in the way, finished. Okay. Our first job after depth determination is to remove all the depth cutters, all the depth, smooth flat prep. Okay, then you move on to the margin. Catch hold of one side first. At no point is my burr not parallel to the long angle of the tooth. Has to be. Okay, you can slightly modify your angulation, but then you grab the other side. The burr is 0.6 millimeter diameter, half the burr would be 0.3. So once your cross prep is done, that means my depth cutters are done, my margins are done, then you move on to the finer nuances. The finer nuances are smooth internal line angle. I cannot stress enough on how important a smooth internal line angle is for the longevity of the veneer. Smooth internal line angle. Is this clear? Any doubts until now? That's it. There's nothing more that you need to do. People who wish to do 2 teeth will work fast. If you want to concentrate on 1 tooth, you do 2 teeth. If you think you're Superman, you do 3 teeth. Okay? Start. Lights on. Okay guys, this is our huge cavity. That's the huge cavity. Okay? That's the huge cavity. So mesially, we have to break contact. Distally, there is no cavity. So on the distal, it will be a type 1 prep. That means no breaking of contact. On the mesial, it will be a type 2 prep where we are breaking the contact. We are going as proximal as we can without going on to the palatal side. Without going on. If it's that huge a cavity that even involves the palatal aspect and the cingulum, you're better off doing a crown. Okay? Doing a crown is not a crime. A lot of people ask me, you do crowns? Sorry, what kind of question is this? Of course I do crowns every single day of my life. Right? Understand this. So you're going to go through and through. Since it is a huge cavity, my thickness of ceramic has to be 0.6 millimeters at least. Since it is a huge cavity, the underneath, this underlying substrate is composite. Since it is composite, if it is 0.3, it will chip because things will flex at a different rate. If my substrate is composite, my thickness of ceramic is the only way I can compensate for the flexion. Has to be 0.6. 0.6, why am I saying 0.6 and not 0.5? 0.6 is the thickness of your burr. Make life easy. All the numbers that we have discussed exactly correlate with the burr. So if you put the burr through and through, you get between 0.6, because the tapered burr, between 0.6 in the cervical area to 0.8 to 1 in the incisal area. It is making life easy for you. Is that clear? Turn your cameras on. This is how the window is done. Same. Okay? I'm going to switch the music off. Okay? Same buckle preparation. Now that depends on your mock-up. If like Josephine we saw yesterday, the teeth are retroplaned, you don't need any major prep on the facial. The facial preparation is more or less the same. What is important is the preparation on the cusp, and it has to be one margin. You can't have 2 or 3 margins. There has to be one uniform joint circular margin. Exactly. So until now is routine. Until now is routine. Now with the same burr, I'm making the window. The window thickness can be the tip of the burr, that is 0.5, 0.6, no problem. You will not have sensitivity there at all. Correct? I don't expect any sensitivity at the cusp tip, but I do expect sensitivity cervically. Do you see the whole window is one preparation? It's not 2, 3 margins. It's maybe 2, 3 margins which are joined into one. This is the single biggest reason you can confidently do premolars and even molars for veneers, and you go beyond the mindset of canine to canine, 3 to 3. Easily doable with a very, very, very high success rate. Correct? This is what is called as the window preparation for premolars and molars. Do I do veneers and molars? All the time. Right? Worn out or occlusally compromised. ये आवाज किधर से आ रहा है? Okay, so it's already worn down. For example, in full arch rehabilitation, already the surface is flat. You don't need to flatten it. It's already worn down, and that's why we are raising vertical dimension. In case of endodontics, you've already relieved occlusion, so it's already flat. You don't need to make it flat, you just need to make it smoother. Correct? It's already flat endodontically for occlusal, for relieving bite. It's already flat in wear cases. Facially, it is the same, no change. Facially, it is the same, no change. Okay, occlusally, I like to do flat. But certain technicians want a palatal chamfer. You can do the chamfer. But please note, the palatal chamfer should be above the biorim. If the palatal chamfer is below the biorim, do a crown. So by mistake, if you push it down, do a crown. When you check your models that are there in your hands, there is a distinct line on the premolars on the palatal aspect that we have made. You will see it in light. That line is the biorim. You will see it in your models in the light. There is a line that is created. Okay, so occlusally we are done. Now this is the palatal chamfer. This palatal chamfer, so it's like a chamfer which usually we make cervically, but it's above the biorim. I hope we have understood the concept of biorim and biodome. Biodome is the strongest part of the tooth. The dome is the strongest part of the tooth. The thickness of the chamfer is 0.6, which is the thickness of the tip of the burr. Did you see how that was done? Okay, we'll move on for a few more seconds and wrap up. The internal line angle has to be smooth. The weakest part of the vonleh is the junction between the facial and the occlusal. So the area there has to be smooth. The minimum thickness of the occlusal area over here has to be 1 millimeter. Minimum doesn't mean 1 millimeter. If you think he's a crazy bruxer, go 2 millimeters. Right? In heavy bruxers in older people, I'm always doing 2 millimeters because their pulp is way away. So you're safe. You can peacefully go ahead and do that extra reduction. Here guys, you can flatten this, just make sure it's smooth, it shouldn't be upper niche. That's it, you can do it like this or do it with a bird. Okay guys, lights on, lights on, lights on.
Where can I have mind scan?
Lower back pile.
यहाँ से अच्छा यहाँ से
Flow में इसके लिए किस कुछ ले बकरी रेडी लगे
फिर से
हाँ पूरा जॉइंट भी यहाँ पे ओवरलैप
तो अभी ऐसे डबल क्लिक कर ट्रिम है ना
फिर भी आ सकता है आ सकता है
बस उतना ही
This is a hit and there is friction. So he is first meeting and then sliding onto this side. Is this clear? Frictional chewing pattern. If it's frictional chewing pattern, diagnose the point of friction and then restore it. Easy. Constricted chewing pattern is a rat, where he is not going to have any form of circular bite. Only tap, 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 tap. So he may not have a lot of loss of vertical dimension, but he will have loss of lower anteriors and upper palatal motion. We can treat this frictional chewing pattern We can treat acceptable chewing pattern. We can treat constricted chewing patterns. All these are due to one time bite left, one time bite right, one time circular, one time flat. This is due to brain mediated, right? Brain mediated. They don't have one singular stop. These
Here. Monorail here. This is a freeway. A lot of buildings around. So that's Atal Setu, 25 kilometers. Atal Setu, looking beautiful. And that's gas plant of Mumbai.
गैस प्लांट बहुत बड़ा है
So this is the famous Marine Drive, the Necklace Road of Mumbai. Yeah, if you could see the rocks. Huh? Such a busy road here. Trident. That's a double-decker bus in Marine Drive. That's nice. ಕೋತಿಗಳು ಎಲ್ಲ ಕಡೆ ಕೋತಿಗಳು ಕುಂತಿವೆ. Oh, lovely Moni. We are in the pedestrian streets of Marine Drive, Mumbai. Have this interesting architectural Mumbai architecture. मेघदूत ऐसे कुछ है, शांति निकेतन, the buildings. They have this entire list of all the buildings. That's interesting. So this is Marine Drive, very happening part of Mumbai. Busy streets.
டேலைட்ல இருந்தால் நல்லாயிருக்கும் கொஞ்சம். இட்ஸ் ஸோ டார்க், நம்ம ஃபேஸை தெரிய மாட்டேங்குது.
That's Mumbai Indians. Enjoying the Marine Drive.
சென்னையில் ஹாரிஸ் கார்னரில் இருக்கு, அதனால தான் அது. இங்கே தான் 450 meters அவேன்னு சொன்னாங்க. அப்படியே சாப்பிட்டு வந்து ஏறிக்கலாம். அவர் தான் நல்லா பார்க் பண்ணுறாங்க.
So this is Chowpatty, Mumbai. Where people are made to sit on this chatai and they eat pav bhaji, dosa, everything. I just had faluda. यहाँ से yummy था. But let me take a video of how they make faluda.
चलो 140 लो 140
So now we are coming back. The time is 12:05 a.m. That is Atal Setu.
Okay. थोड़ा मुंह ऊपर करो बस. Okay, so now spray के लेना. साक्षी हिलो मत लगेगा. थोड़ा आराम से. थोड़ा खोल. अरे मुंह तो खोलना पड़ेगा ना. Slowly, slowly, slowly. थोड़ा कैमरा एडजस्ट करो प्लीज. Can you see? Temps are out here. I'm going in. That's my central. I see good proximal fit. I see good cervical fit. थोड़ा zoom out करना पड़ेगा. Only then they can see. And I see good palatal fit as well. और थोड़ा हाँ बस. Good palatal fit as well. No problem. Okay, central out. Other central. These are dry fits. There is nothing. There is no jelly, no nothing. I see good cervical fit, good interproximal fit, good palatal fit. Occlusal mirror. थोड़ा दूर चले. Good palatal fit as well. No problem. Very thin. Lateral. कोणते बोलते? All good here as well. Okay, and now I do a collective try in the exact same sequence. Central, central, central. Lateral, canine, premolar. So far so good. I don't see any open contact. I don't see any tight contact as well. Lateral. Canine, premolar. Occlusal mirror, everything absolutely fine. I see no open contact. We are doing well. There are 3 areas which it's a little short, very marginally on both the laterals, distally, and zoom out please. Okay, 1 second. It's a little short on the 1-4 here on the occlusal surface. It's a little short on the 1-4 occlusal surface and very marginally on the distal aspect of this lateral, distal aspect of this lateral. Very, as in not this, more this. Over here is also okay. Now zoom in slowly. Zoom in. Okay, I'm going to move her head. ये कौन जाता है? This one. Can you see the premolar shot now? Right at the bottom of the screen. थोड़ा नीचे देखो साक्षी, नीचे देखो, अभी ऊपर देखो थोड़ा. हाँ, now you can see clearly, right? Premolar very marginal, nothing major. Okay, थोड़ा नीचे देखो और ऊपर देखो अभी, और ऊपर. Can you now see the lateral? Not so much. I'm telling you, it's super minimal. Super. If you don't get magnification, you won't even see. It's that minimal. Okay. Overall, good fits. No, you can't see any open margin at the palate. I'm going to move. No open margin at the palate. Everything is fine except
Premolar.
premolar. 1/4. Except 1/4. This one. This one. Except this one. Everything else is a super fit. No tight, no open, no nothing. Okay, so that completes our trial. What have I done with my gloves right now? I have done a try-in. I have done a try-in with what? KY jelly. KY jelly is what? Separating medium. First glove change. Like caliper. बस हो गया. Veneer. इधर गया. हाँ. Can you see the veneer?
Yes, sir.
Yes, you can. Now can you measure how much it is? Zoom in now. Zoom in. How much is it? Too much of magnification. Hydrofluoric acid edge up to the margin. Hydrofluoric acid edge up to the margin. Hydrofluoric acid edge up to the margin. I don't do 3 teeth at once because in this time this is already 10 to 12 seconds. Correct?
This is 9%.
This is 9% hydrofluoric acid. Absolutely correct, sir. This is 9% hydrofluoric acid from the company Ultradent. Ultradent porcelain edge 9%. From here now I will put the net. I will put the net and now 3-way syringe and wash. Okay? I am using a bigger syringe. This is my micro etcher, but there is no powder inside. It's only water. Should I say? There's only water that is coming out so that it's easier, it's faster. Chalo. Wash nicely, 60 seconds.
You can modify your putty bed.
Sorry, sir.
Putty bed.
Putty bed is also happening, sir. We have to. Putty bed is here. I'm just
Right.
waiting for it to set.
यानी पट्टी बेड को आप वो अपना बर्ड स्टेरिलाइजर का छन्नी नहीं आता है,
सर सब कर सकते हैं सर.
उसमें डाल दे तो हो जाए.
हाँ वही ना करवा चौथ का.
वही करवा चौथ वाला.
वही सर. Yeah. For us Gujarati people there is no करवा चौथ. Yeah, right.
इसका पेटेंट भी नहीं टूटेगा.
मला काहीच दिसत नाही. तिकडे ऑन आहे. Okay, we'll clean this. I'm going to just hydrofluoric acid etch the other so that my nurse can go and clean it in the other room. Okay, putty bed. Advantage of putty bed is no hydrofluoric acid will flow onto the facial surface.
Seconds ಅಷ್ಟೇ.
Okay, and then clean. That's it. Yeah. Couldn't get it. Okay, so I'm sending this to my nurse to clean it, okay? Not cleaning it on my own. Too boring.
This can be sometimes the difference in debonding. Underclent intaglio surface. To remove the smear layer.
Okay, let's start. Rubber. Okay, we have a rubber dam sheet and I have a template. Clear? Everybody can see?
Yes, sir.
Okay. So now with my pen, I'm just going to first mark L, stands for lower left, so that I have orientation. I'm going to mark 6 and 6 because my clamps are going to go onto the 6. Once I have done that, this goes away. Okay, I need thoda niche exam. Pen one and pen. 6, little low. Yeah, pull kara, punch that. So we will now punch the 6 and the 6. Up. अरे यार. Okay, so punched. Now I will connect the two dots. I am not going to cut in a U. I am going to cut in a straight line. Okay, so my dam is split. Now let's go inside the patient's mouth. Sakshi kholo. Okay, so you may see my head in the middle sometimes. So my clamps are already selected on my model. So we are now going to, so the L comes at lower left. Okay, can you see? We are now through the split. Through the split, opening her teeth. One second. So she has a very low lip, so that's going to be slightly tough. Okay, so can you see the split is done?
Yes.
I'm going to clamp now, stump the finger out. One second. On the molar, I'm going to clamp. One second. Actually, एक second होगा. तिला है ना, we need to follow it. हाँ बस. But do the small one. Give me a smaller clamp. That is a big clamp. Give me a smaller clamp here. Okay, floss out. Of course, your clamps should be flossed. And now we will put the frame. Done? So So we have successfully, one second, okay? One second. Camera. We have successfully, zoom in now, split damned, where the cheek is retracted, lip is retracted, there are no hands, only there is a gap here, correct?
Yes.
Now that gap will be closed with putty. Suction करूँगे पूरा. Putty. So cheek done. So this is two hands. Cheek reflected, only the suction hand we will now close. Cheek reflection done, everything done, no problem. We can peacefully work. We will just close this gap now with some putty. That will also stabilize the clamps. Push this on the clamps as well, so that so get stabilized, and we let this set. So there will be nothing now, there will be no leakage from here as well. Okay, all good. Everybody clear?
Yes,
It's
sir.
easy, there's no big deal in this.
No suction now.
Sorry, no suction, sir. Where to do suction? Everything is done. There will be no suction. If she needs suction, we will have to lift over here and do it. Okay. No suction, sir. There will be no contamination, no?
But some patients do saline. Having a
Sir, they have to gulp it down, or you have to lift from here
Okay.
and do a small suction. See. So everything is now sealed, nothing will go in. Huh? Set nahi zala, sorry. We are waiting for this to set. थोड़ा reflect कर रहा था. Enamel, we are completely in enamel, so at least 15 seconds of edge. Etch it, please. हे झालं होतं ना घेऊन ट्राय. घ्या. Okay, sir, H is done. थोड़ा zoom in करो ना please. Zoom in. और zoom in करो थोड़ा. थोड़ा और करो बस. Okay, perfect. So edge done, wash vigorously. Each took 15 seconds. This is your last wash. Last wash coming in. From here, I am now going to change my gloves again. Second change of gloves. Okay? Dye everything nicely, please.
At some point, some bleeding spot is visible.
Yes, sir.
Can
So
you
you,
put water clot and
it is because of the water. If you have a laser, you can laser it out.
okay.
Otherwise, that's very minor. So if you put some bond, you should be okay. Now, what I am doing, guys, is it is understand flow. So my gloves are black. So when you see, I want you to see how my nurse is giving me stuff. So my gloves are black, my nurse's gloves are blue, so that you know who's bonding and who's giving what. Okay? Okay, but I will have to put a filter. This is me. Black. Chalo, filter. Okay, nice frosty appearance on the teeth. Chalo. We're putting a filter, guys, okay? Otherwise we'll set like crazy. Super fast. थोड़ा सा करना है. Now my nurse is putting bond on the veneers. Now I am now putting bond on the tooth. I'm using a big micro brush first. एक सेकंड का मैं लाइट बंद करता हूँ. थोड़ा ऐसा दिखा सकते. हाँ बस. Okay, so big micro brush. Applying bond. I'm applying my first layer of bond. Slightly zoom out, Yogita, very little. First I'm applying my first layer everywhere. Louder. That and veneers done. Bond. Please be generous over here, okay? It's a generous layer of bond. Please concentrate here. Correct, press. Okay, so that's my first layer. Now each tooth scrub for 20 seconds. Each tooth scrub. There is nothing like over bonding, but there shouldn't be a big puddle. Scrub. Okay, take your time. There is no rush. Even if there are certain areas of dentin that you may have missed by mistake, should get nicely sealed right now. Okay, this bonding and scrubbing of the bond is a very important step for bonding and to prevent any form of sensitivity. My micro brush is not going here, so now you use a smaller size micro brush, but you have to go in everywhere. Okay, in everywhere, interdentally, in everywhere. The bond. Ready. Okay, so bond very light air to remove all the puddling. Oil-free compressors mandatory to remove any puddling. I don't want my bond to be dancing around. Yeah, ready. So now this is my nurse's hand. She is giving it to me in my hand. She is loading. Load kara in the camera. Load in the camera. Superb. I am taking the veneer. She is keeping it like this. I am taking it in this hand and I am squeezing it in. Thoda jasta kara. Okay, that's the change of hands. Your other nurse can have a gauze like this, which you can keep cleaning your fingers with, because it makes it a little sticky. Okay, you can use a micro brush now. Just clean whatever you can peacefully, no stress.
We are using only light cure
So
material.
only light cure. This is Relax Veneer from 3M. Only light cure. That's why I'm taking so much time. If it was dual cure, I wouldn't even talk. Everything would have to be super fast. This is Relax Veneer shade TR because we had no show through. We will see that, sir, in 1 minute. Premolar, I like to. Now this is Relax Veneer. You can even put it little bit in the mouth like this as well. It gives you lot of working time. At this time, take a mirror and see if everything is fitting in fine. Okay, occlusally, incisally, check everything, please. Very important that we check everything. You have enough time. That is the advantage of light cure. You have so much of time before you can see everything. No rush, no issues. Okay, premolar again. Okay, so all the veneers are in now, like routine cotton there. I'm gonna now peacefully check everything. Matlab veneer press there. Just remove the excess cement slightly from the surface. Take a routine micro brush, clean whatever I can inside and palatally. Inside and palatally as well. Okay, I have enough time, it's not going to set. Clean as much as I can without causing any movement. That is important. Without causing any movement. Check if everything is fitting nicely. The motion should be towards the cervical. So if you need to take a video of this. Okay, you have this tip which is in small and big size. These are excellent to give stability. Small and big. This can be used for onlays, crowns, everything. Okay, it's silicone tip, so doesn't stick or anything. Okay, excellent material. Palatally also everything looks reasonably clean. There's of course a little bit here and there. Chalo, take care.
Sir, do you suggest placement of retraction cord during this stage?
Madam, can you please give me 2 minutes and I will
Sure.
come back.
Sure.
Only in case of subgingival margins. Yes. Okay, I'm just making sure everything is seating nicely, okay? Again, this is my final check. A final check, just checking if everything is seating nicely. I think everything is good. See the amount of time that we are getting, right? We won't get this time on. Karo, tag cure each tooth. Oh, the tag cure ready, you know. So, madam, if it's a high lip line, I don't like to put retraction cords because sometimes when you remove it, it can cause bleeding Sometimes when you remove it, it becomes difficult to remove also sometimes. If I have to retract, I put a gingival retraction paste for 10 minutes and then do it. It gives you enough retraction. I don't like to put cords during bonding at all. I have had issues where it becomes difficult to remove it. Flossable, no worries. There, KY. So now KY jelly again. Okay, I see a little cement here. Thoda. Okay, jelly, especially at the margins, huh? Margins. Ceramic doesn't need the jelly. And now cure 3 front, 1 back. Okay, and now we cure everything 3 cycles front, 1 cycle back. Okay, clear? So I do not put retraction cords. I have had experiences where after tack cure, when I remove the retraction cord, sometimes it bleeds, sometimes it doesn't come out and it becomes a struggle. So if I need to reflect, I put a retraction paste, let it retract, wash and then do it. It gives you enough retraction. Okay, I do that. Tack cure is a super important stage. So like I said, the tip is very important. However, I'm going to go in, has to be on ceramic. Your pressure needs to be on ceramic, not on gums. Alternatively, which I don't do ever, I need a TC here, TC. A lot of mentors or a lot of speakers may suggest ultrasonic here to remove. I disagree completely. You will damage the ceramic or a tungsten carbide. I never do it, never. I'm only using a 15 number blade. You will see some red, don't worry about it. Can you see the excess cement? Slow movements. Can you see the cement coming out? Doctors with a mic, please respond.
Yes, sir, we can see.
Thank you, madam. Okay, so we're cleaning everything here. I would rather have this bleed now than bleed later. Slow movements, pressure on the ceramic, never on the gums. Pressure on the ceramic. 15 number blade to remove the 15 number blade to remove any cement that may be there on the body. 15 number blade does not cause any scratching of the ceramic. See? Does not cause any scratching of the ceramic. You may not be able to see it. And if you don't remove the cement from here, that cement will become fluorescent yellow. And the patient will come back. But it's okay, over here you can then remove it. You don't need anesthesia for this. But over here, has to come out. Okay, so we did 15, we did 12. These are 0.1 millimeters. These are known as spacers from Kosuva. And these go in. Okay, these are smooth sided. You see, this is smooth sided on both sides. There is no abrasive. Smooth sided on both sides so that there is no compromise of glaze. It simply goes in like this. That was a non-flossable area, right? Nice, superb separation of teeth. Working on separation of periodontal ligament unit. थोड़ा pressure आएगा, don't worry. Floss. Reflect. Okay, so now let's see. All good. Superb. Okay, so everything nice and flossable. I still see some excess cement somewhere. Finger do. I'm now going to go to the palatal surface to see excess cement there. Yellow ring to remove any excess cement that I see on the palatal surface. Suction. Very good, sir. Excess cement on the palatal surface with hardly anything. Hardly anything. Sakshi, close. Okay, so now how do we check occlusion? The first thing I do is basic occlusion. Zoom out slide. 40 micron articulating paper. 40 micron बड़ा खोलो, बंद करो.